Hey, this is Giovanni Santiago, the root cause coach. And today I'm going to go over the difference between Zepbound, Tirzepatide, Mounjaro, and Ozempic. This is a complete training course. It's my training course 101. I hope you enjoy and get all the value you need from this so you can make a proper decision on what to do, whether you are going to go ahead and go with any of these meds. So what is Zepbound? Zepbound is a new weight loss drug that's FDA approved to treat obesity in adults. It's made by pharmaceutical company Eli Lilly and contains the active ingredient tirzepatide. Tirzepatide is also found in Mounjaro, a type 2 diabetes drug that is also made by Eli Lilly. Zepbound is approved for chronic weight management in adult patients with obesity or who are overweight with weight-related medical health conditions. Tirzepatide belongs to a class of drugs called dual glucose dependent insulinotropic polypeptide, GIP, and glucagon-like peptide 1, GLP-1 receptor agonists. The dual action of GIP and GLP-1 affects blood sugar and food intake in multiple ways, including prompting the pancreas to release insulin when blood sugar levels are high, decreasing the release of glucagon, which aids in lowering blood sugar levels, slowing the process of stomach emptying, aiding in appetite control and reducing food consumption, encouraging a feeling of fullness following meals. Zepbound is supplied as a pre-filled pen with the needle on the end. It's given to patients as a subcutaneous injection delivered under the skin once a week, and it's virtually painless. So what is Mounjaro? Mounjaro is another brand name for the medication tirzepatide. Tirzepatide is the same active ingredient in Zepbound. Mounjaro was approved by the FDA in May of 2022 for the treatment of type 2 diabetes. Like Zepbound, Mounjaro is manufactured by the pharmaceutical company Eli Lilly. It belongs to the GIP GLP-1 class of medications as well. Mounjaro, which is also administered as a weekly injection, works just like Zepbound. As explained, it helps the pancreas to control how much insulin is released. It also slows down food absorption to make you feel more full and reduce how much you eat. In general, higher doses of tirzepatide have been shown to affect body weight. However, it's indicated for diabetes management, not weight loss. In other words, weight loss is a side effect of Mounjaro. Prescribing it for weight loss is an off-label use of the medication. Weight loss. What is Ozempic? Ozempic is the brand name for semaglutide, a medication made by Novo Nordisk. The FDA has approved Ozempic to manage blood sugar levels in patients with type 2 diabetes. Semaglutide belongs to a class of medications called glucagon-like peptide, GLP-1 receptor agonists. This makes it slightly different from dual GIP and GLP-1 receptor agonists like Mounjaro and Zepbound. GLP-1, glucagon-like peptide 1, drugs mimic the action of GLP-1. GLP-1 is a natural hormone produced in intestines in response to food intake. When you eat, GLP-1 is released from your intestines. It signals the pancreas to release more insulin or hormone that lowers blood sugar levels. Insulin helps glucose in your bloodstream enter the cells, where it can be used for energy or stored for later use. GLP-1 ensures that insulin is released when needed, such as after a meal when blood sugar levels rise. GLP-1 reduces the release of glucagon, another hormone produced by the pancreas. Glucagon has the opposite effect of insulin. It raises blood sugar levels by signaling the liver to release stored glucose into the bloodstream. Medications like Ozempic, Zepbound, and Mounjaro also help slow down the emptying of the stomach. This helps to control the rate at which carbohydrates from your meal enter the bloodstream. Ozempic doesn't just help regulate blood sugar levels. It also helps adults with type 2 diabetes who also have a known heart disease to reduce the risk of major cardiovascular events like heart attack or stroke. Ozempic is available in several dosages and is given to patients on a once-weekly injection. So what's the difference between Zepbound, Mounjaro, and Ozempic? Mounjaro and Zepbound are the same compound, tirzepatide. However, Mounjaro has been branded by Eli Lilly as a treatment for type 2 diabetes and will likely have slightly different administration devices. Mounjaro with an adjustable dosing in an injectable pen device, and Zepbound with fixed dosing in an injectable pen device. Ozempic, on the other hand, has a different active compound, semaglutide. Ozempic is categorized as a GLP-1 receptor agonist instead of a GIP/GLP-1 receptor agonist like Zepbound and Mounjaro. In a head-to-head trial, semaglutide and tirzepatide was superior in weight loss outcomes. At the highest doses, users of tirzepatide lost about 12 additional pounds compared to those using semaglutide. But you are using more, so that's something to consider. So who are these medications recommended for? Who are these medications recommended for? And are there people who should not use them? The evidence and the efficacy of these medications is strong, but they're not without side effects and some risk. Clinicians will usually prescribe these medications like Zepbound, Mounjaro, and Ozempic if your body mass index or BMI is 30 or higher, 27 or higher if it's accompanied by weight-related medical conditions such as high blood pressure, heart disease, type 2 diabetes, prediabetes, high cholesterol, non-alcoholic fatty liver disease, and obstructive sleep apnea. These medications are not indicated for people in any of the following conditions. A history of pancreatitis. It's suggested that GLP-1 agonists are associated with an increased risk for pancreatitis and pancreatic cancer. A personal family history of certain thyroid cancer. So both tirzepatide and semaglutide have a boxed warning from the FDA. This is due to the rare but serious risk of developing thyroid tumors from this medication. Using this medication helps you feel full for longer, but also can increase the risk of GI issues. For these reasons, you should have an in-depth conversation with your doctor about your medical history before considering weight loss medication. If you don't have a doctor, no worries, I got that covered. Be sure to bring up if you're pregnant, you're breastfeeding, or planning to get pregnant soon. So what's the cost difference between Zepbound, Ozempic, and Mounjaro? Costs are largely dependent on your insurance status. If you're insured, the price of these medications depends on the rates negotiated by your insurer. So without insurance, both semaglutide and tirzepatide, it costs around $1,000 a month. Prices for the diabetes versions of Ozempic and Mounjaro are typically a bit lower than prices for weight loss versions of Zepbound. So think about this. Zepbound or tirzepatide has been set at a list about $1,060 a month before insurance. Mounjaro, tirzepatide, usually costs between $1,020 to $1,200 per month before insurance, and Ozempic, semaglutide, usually costs between $850 to $1,000 per month before insurance. Now, if you're concerned about the cost, the great news is still coming. As a member, you're now going to learn in the next module about our secret go-to hack that I personally use to save over 70% off semaglutide and tirzepatide by using compounded pharmacies that we have agreements with. And we actually have a sublingual version of tirzepatide that reduces side effects by over 80%, and it does not require you to take any shots. And this is exciting. I'm going to get on this one because I don't like some of the side effects. So here's a quick summary. Ozempic and tirzepatide are FDA-approved medications for managing weight and blood sugar levels in type 2 diabetes. Both medications offer benefits in weight loss and blood sugar control. Ozempic is generally for type 2 diabetics, but can also be used for weight off-label. Ozempic contains semaglutide, which mimics GLP-1 hormone. It regulates blood sugar levels, reduces appetite, and promotes weight loss, and it slows down the stomach empty. Tirzepatide combines GLP and GIP hormones, controls blood sugar levels, it has a higher potential for weight loss by targeting different pathways. Zepbound is the brand name specifically for the weight, tirzepatide. Mounjaro is the brand name used for type 2 diabetics, which is tirzepatide. Okay. So basically what it comes down to is tirzepatide is going to be a little bit stronger. It's going to go under the name Zepbound. Mounjaro is going to be used for type 2 diabetes, but they use them basically for both. So it's really up to you and your doctor. I hope you received value from this. Get on the next module, the next training, because I'm going to show you how to save over 70% on all of this.